Chapter 25, the Reproductive System, Part 1. So we'll start with the male reproductive system. Functions of the male reproductive system include the testes producing sperm and testosterone, the ducts that transport, store, and assist in the maturation of the sperm, the accessory sex glands that secrete the liquid portion of the semen, and the penis, which contains the urethra, which is a passageway for ejaculation of semen, and as we know, also the excretion of urine. So the testes are ovoid organs that are primarily function is to produce sperm. They're located in a muscular pouch hanging off of the pelvic cavity called the scrotum. And there turns out to be a structure called the septum that separates the scrotum into two compartments so that each testis has its own compartment. Now, the testes are in a somewhat vulnerable location. Why are they positioned hanging off of the torso of the body? Well, that's because sperm production is best occurring at about 2 to 3 degrees lower than body temperature. And by having the testes hanging off the torso of the body, they're able to maintain that ideal lower temperature. And then the muscular tissue within the scrotum can adjust the distance of the testes from the torso to adjust the temperature. So the testes, if you cut them open, are filled with lots and lots of tiny coiled tubes. These coiled tubes are called the seminiferous tubules. And it is within these seminiferous tubules that spermatogenesis occurs. So sperm production occurs within the walls of the seminiferous tubules. There's a little cross section of the seminiferous tubule, and these little dark spots represent the nucleuses of sperm that are being produced. And then the other function of the seminiferous tubules is to then send the sperm, the immature sperm produced in the testes, into an additional structure hanging off the testes known as the epididymis. So sperm production, important function within the seminiferous tubules of the testes. The spermatogenic cells are the stem cells that produce sperm. So there are spermatogenic cells within the seminiferous tubules that will divide, and one of the cells will become the sperm, the other one will remain a spermatogenic cell. There are also additional cells that form the walls of the seminiferous tubules. These are called sustentocytes. And they, besides forming the structure of the seminiferous tubules, also form what's called the blood-testis barrier. And the blood-testis barrier is very important because it protects the sperm being produced from the male's immune response. The sperm, being genetically distinct from the male cells, would be attacked by the male's immune response if exposed to it. So that blood-testis barrier is very important. Outside of the seminiferous tubule structure is some blood capillaries, as we'd expect, to bring nutrients and so forth, and also additional cells called the interstitial cells. And the interstitial cells are the cells that produce the hormone testosterone. So the testis also produces the hormone testosterone, and this has to be outside of that blood-testis barrier because we want the hormone to enter the bloodstream and travel throughout the male's body. So spermatogenesis. Spermatogenesis is a process of cell division called meiosis. And in meiosis, we start with a stem cell that is 2N that has 46 chromosomes. And then it goes through 2 cell divisions, giving us a final product of 4 cells, each with an N chromosomes. So 4 cells with only 23 chromosomes. So we start with 1 cell with 46 chromosomes. We end with 4 cells with 23 chromosomes each. We need the number of chromosomes to be halved. As we know, the sperm will eventually go and fuse with the oocyte, the egg cell, to bring us back up to the 46. So initially, we have these spermatogenetic cells dividing, and one of them becomes the primary spermatocyte. This would be the beginning of spermatogenesis, beginning of meiosis. Then there's the first cell division, giving us 2 secondary spermatocytes. each now with only 23 chromosomes, and then a second round of division of each of those secondary spermatocytes, giving us the spermatotids that then become the immature sperm. So again, one cell, one becomes 4 distinct cells with only half the number of chromosomes. This is what a sperm looks like. It has a head. Within the head is the DNA, the 23 chromosomes, and then the flagellum, the long tail. And the function of the flagellum is to move the sperm along the female reproductive tract. Epididymis. Epididymis is a comma-shaped organ. As you can see here, lies on the posterior superior side of the testis. It is also filled with a long coiled duct, about 20 feet long. And what happens is the immature sperm leave the testis and go into the epididymis. There the sperm will be stored for days, weeks, or longer. And while they're being stored, the sperm will mature. So the sperm matures in the epididymis, and this takes a certain amount of time. After the sperm have matured properly, they will be transported out of the scrotum via the ductus deferens. This is a long tube that travels up out of the scrotum over the pubis bone and through the abdominal wall into the pelvic cavity. And so here's the urinary bladder. So the ductus deferens goes over the top of the urinary bladder and ends posterior behind the urinary bladder. So the ductus deferens, as it's leaving the scrotum, is in a larger structure called the spermatic cord. The spermatic cord has connective tissue on the outside defining its shape. The spermatic cord has blood vessels, nerves, and so forth going to and from the testes. And also, of course, within the spermatic cord is the ductus deferens. When they reach the inguinal canal, which is an opening within the abdominal wall, the ductus deferens will then move and continue its route through the pelvic cavity on its own. Whoops. The ductus deferens' job is to transport sperm. It is transporting sperm from the epididymis to a larger widened area of the ductus deferens behind the urinary bladder. There the sperm is stored for a short period of time and then released during ejaculation. There is a short duct called the ejaculatory duct that is formed from the ductus deferens and the duct coming from the seminal gland. The ejaculatory duct goes through part of the prostate gland and empties into the urethra of the male. The ejaculatory duct, as the name implies, only functions during ejaculation. So it's going to carry sperm and the fluids from the seminal gland into the urethra. And then urethra will transport the sperm from the prostate gland out the penis and out of the body of the male. Inguinal hernia. An inguinal hernia is when a portion of the small intestine pushes out through the inguinal canal. This is actually rather common among males. It's predicted somewhere around 2/3 of men will have an inguinal hernia at some point in their life. If left untreated, the intestines can continue to bulge out, can get twisted, cutting off blood flow, and lead to death of part of the small intestine. This would be very bad and could lead to major complications in the male. This is more common in males than females because males' inguinal canals tend to be larger than females. One reason because men tend to be bigger than women. The other reason being that with the spermatic cord structures passing through the inguinal canal, it by definition has to be a little bigger. All right, accessory glands, glands that produce fluid portion of semen. Already mentioned one of them, the seminal glands. The seminal glands lying on the posterior side of the urinary bladder. They release fructose, a sugar, and nutrients into the ejaculatory duct. Those nutrients and fructose are important for the sperm's function. The prostate gland, this chestnut-shaped organ directly underneath the urinary bladder, contains part of the urethra, the beginning of the urethra, and it produces fluids that help in increasing the motility of the sperm so that when the sperm become active, when they begin to beat the flagella, they will be able to do it more effectively. And then finally, there are two small glands, the bulbourethral glands, that empty into the beginning of the urethra in the penis. And the bulbourethral glands secrete mucus. Mucus, of course, is there to lubricate the urethra to help in the release of the semen. And as a consequence, some of the mucus becomes part of the semen. Precum is actually some of that mucus secretion from the bulbourethral glands. The penis itself is the structure that contains the urethra and delivers the sperm to the outside of the body. There's the root of the penis, which is within the abdominal wall. There's the body of the penis, the bulk of it, part of which comes out and is referred to as the shaft of the penis. And then, of course, there's the glans penis. That is the head of the penis. And the glans penis, when a male infant is born, is covered with what's called a prepuce, the prepuce, more commonly known as the foreskin. And also found in the penis is some additional important tissues. There is the tissue called the corpus spongiosum. Corpus spongiosum surrounds the urethra within the penis. The job of the corpus spongiosum is to keep the urethra open during erection. Also, most of the tissue within the glans penis is corpus spongiosum. There are two other tissue structures referred to as corpora cavernosa. Corpora cavernosa are the structures that deal with blood during an erection, so they will expand as blood fills them, causing the penis to become erect. Some disorders associated with the male's reproductive system. There's priapism. Priapism is a persistent and painful erection. It does not have to involve sexual desire. It can last for several hours. If it lasts for an hour or more, the male should get medical attention because it could lead to damage to the penis. Another issue, acute and chronic prostatitis. Prostatitis is an inflammation and swelling of the prostate gland. This can cause the prostate gland to limit the space of the urethra within the prostate gland, and that could decrease or even prevent the flow of urine. And also, it'll push on and decrease the volume in the urinary bladder, making the male feel the need to go to the bathroom more often. And often, prostatitis is painful. There is also prostate cancer, cancer within the prostate organ. This is the leading cause of death from cancer in men. And basically, the way to detect it is at a certain age, a male will get an annual physical, and during that physical, receive a digital rectal exam where the doctor inserts their index finger into the rectum and palpate, feel the prostate gland, and determine its relative size. And then, of course, by having a record of the size of the prostate gland, it is then possible to determine if it's getting larger and potentially then decide whether to determine whether or not that's by cancer. All right, the female reproductive system. Functions of the female reproductive system include the ovaries producing the oocyte or egg cells, and the female hormones, estrogen, progesterone. The uterine tubes that carry the oocyte after ovulation from the ovaries down to the uterus. Uterine tubes are often the site of fertilization. You may have learned them as fallopian tubes, but we are going to use their official name, which is uterine tubes. And of course, we have the uterus. The uterus is where the fertilized zygote egg cell will implant and develop into an embryo in the fetus, and where it will be housed and protected. And then eventually, the muscles in the uterus will lead to the expulsion of the infant during childbirth. There's, of course, the vagina, which receives the penis to allow for fertilization, and it is also the passageway during childbirth. And then finally, the mammary glands, which are synthesizing and secreting milk for the newborn, the healthiest, best food for a newborn infant. And this is where we'll stop for this part of the lecture.